Next, we move on to the types of data that in a hospital setting, which are the types of data that are collected. So when an institute exists, it comes with the basic infrastructure like the layout, plan, etc. So that is the hospital infrastructure, which will include the bed capacity of the hospital, the operation theatres, etc., and all the facilities that are required for smooth functioning of that hospital and eventually the patient care. The next main part which comes is the patient details, right from their personal details to their epidemiological profile to their treatment profiles in the past and the present problems. The clinical management of the patient is another data which will exist when the patient gets into the outpatient department or the hospital, and then the data that is collected daily. So it's an ongoing data that needs to be collected. And the outcomes, as I had mentioned earlier, that whether the patient improved, became critical and had to be shifted from one ward to the other or to the ICU or to the operation theatre, that tracking of the patient during the hospital stay, and the outcome will be including the discharge or unfortunately sometimes we lose the patient. So that outcome data is required. Death audits are also a type of data which tells you a lot of information as to what could have been done to save this person's life, and these audits require the data of the patient in detail, where a committee then analyzes it and gives out the data in a form where you can improve the patient care. A huge part of the hospital depends a lot on the laboratory backup which is there. So the main laboratories which we come across are the microbiology lab, the biochemistry and the pathology department, and also a separate entity called the life-saving blood bank. So this data is integrated into the patient data in the hospital, in the outpatient operation theatre. So that is another place where a lot of data is generated and it has to be appropriately attached to the patient whom it belongs to. We have seen that during the COVID-19 pandemic, a lot of oxygen was required for better management. And when something is required in excess, we should also know whether we are utilizing it properly, and audits need to be done so that the scarce commodity like oxygen during pandemics is utilized to the best of its efficiency as well as in the audits. The next two stores where a lot of data is generated is in the medical and the surgical stores, which is where the patient improvement or the patient treatment is all dependent upon. Who runs all this infrastructure as well as the different departments as well as patient care is an entire human resource department, and that all data is also collected, and an efficient management of the human resource is what is required in a hospital setup. Any hospital comes with its medico-legal aspects, and whenever you have medico-legal problems which come up because of the accidents, or you have insurance issues, or there are accidents which occur, so all the documentation which is required is highly important for subsequent court appearances or the benefits which a patient can get from the insurance companies. Since Sassoon Hospital is attached to a premier medical college, a government medical college, a lot of research is done, and data that is generated from here have in the past helped us to change the WHO guidelines in relation to patient management. So this research data which is there is collected separately. It is of course patient data, but with all the ethical approvals etc. is collected and then analyzed, and eventually it is peer reviewed and published. So these are the various types of data that we do collect routinely, and in pandemic situations the amount of data that has been collected, generated, analyzed and given out to the concerned authorities is quite a bit, and we'll proceed further to see what we do with this particular data.